This video will demonstrate how to perform infant CPR under 1 year old and child CPR 1 year to puberty. CPR stands for cardiopulmonary resuscitation. First, check to see if the infant or child is conscious, responsive, and breathing. Do this by shouting and tapping or flicking the bottom of the infant's foot. Look to see if their lips are blue. If the infant is unresponsive, not breathing, or has turned blue, have someone call 911 while you assess if CPR is necessary. If you are in a public area, ask someone to find an AED. If you are alone, check for a pulse and breathing, then start CPR. Do your best to stay calm. Place your fingers on the inside of the child's arm, just below the armpit. Gently press between their bicep and tricep to feel a pulse for 5 to 10 seconds. Watch or feel their chest for 5 to 10 seconds. If the infant or child's chest is not rising and falling, they are not breathing. Make sure the infant or child is on their back on a flat, hard surface. Remove their clothing if you prefer to see the chest, and kneel beside them. Picture a horizontal line drawn between the infant's nipples. Place your index and middle fingers of one hand just below this line in the center of the chest. For a child 1 year and older, place 1 or 2 heels of your hands directly on the sternum between the child's nipples. For infants, compress the chest down about 1.5 inches and pump for 30 compressions. Your rate or speed should be 100 to 120 compressions per minute. Keep a fast pace. For a child 1 year and older, compress the chest down about 2 inches and pump for 30 compressions at the same rate or speed of 100 to 120 beats per minute. After 30 compressions, move quickly to open the airway by gently tilting the head back, lifting the chin with one hand while pushing down on the forehead with the other. Once the infant's airway is open, open your mouth wide and cover both their nose and mouth with your lips, being sure to make a seal. For a child 1 year or older, seal your lips around their mouth and pinch the child's nose closed with your fingers. Gently blow a puff of air until you see the infant's chest rise. Next, let the air escape so the chest goes back down. Do this a second time. Rescue breaths should be 1 second long. For a child 1 year or older, make a tight seal and blow 2 small breaths that cause the chest to rise. Allow the child to exhale in between your breaths. Each breath should be 1 second long. After completing the 2 rescue breaths, immediately go back to 30 chest compressions followed by 2 more rescue breaths. If you are by yourself and do not have a phone close by, keep doing CPR for 2 minutes before calling 911. 2 minutes of CPR is about 5 sets of 30 compressions and 2 rescue breaths. After every 2 minutes of CPR, check to see if the infant or child has started to breathe on their own. If they are breathing, you can stop CPR. If they are not breathing, keep going until help arrives. Continuous CPR saves lives. Please visit our website to learn more about caregiving resources and training.